Today we're working with Ann. Ann is a super active mom. She comes in because chiropractic has helped her run, lift weights. She does different competitions and work and be a mom. So today we're just going to do an assessment. We're going to see how her low back is working. We're going to look at her knees, her feet, her ankles because she likes running. Just a good overall assessment. We're also paying attention to how is her nervous system performing, because that's ultimately what we do. If her brain can efficiently work with the rest of her body, that's what allows her to work out, go to work, help her recover, avoid injuries. So we're going to go through our process here, our protocol. So Ann, head to the left, head to the right. All right. Relax in the middle there. So we've got a subluxation up in the cervical spine we're going to address. We're going to assess the low back here. Lift this leg, lift this leg. So I'm just feeling how the muscles are contracting in her low back. She has some excessive pulling to the left, which is, it's common for her where this hip flexor wants to adapt and fire too hard. So we've advised her over the course of her treatment, we're not going to stretch the hip flexor. That would make it worse. We're going to relax it. We also give her some home care instructions so that she can manage it as much as she can on her own. All right. So as I'm palpating here, I'm just observing her breathing. So just keep breathing in. And that helps me, again, it's part of my neurology training of knowing exactly where to adjust each patient. And then we're going to use our integrator. It's extremely precise. We're not going to twist or pop her neck. We want to move just one bone here. All right, just keep breathing for me. So a nice gentle adjustment. So when we adjust the spine, we're restoring the biomechanics, the alignment, the movement of those bones and those joints. That immediately makes a change to her nervous system, how the muscles are working in the spine. Okay, lift here again. Does that feel lighter? So her leg already feels lighter. The adjustment we did, C2, is helping to relax her hip flexor. So if you're watching and you have chronic low back pain, the problem could be in your neck. It could be a low back problem as well. But for most people with low back issues, there's a problem with the neck. We're going to adjust some ribs here. So these adjustments along the rib cage, a little tight in there today. You feel that?
Yeah.
So this is causing her hip flexor to hold a little too much tone, which eventually is going to wear on her SI joints, her low back. Lift here, lighter. So that feels really good now. When this leg goes up, this muscle is nice and relaxed. She should be contracting on the opposite side of her low back. Okay, head to the left. Head to the right. Okay, head in the middle. We got something else up in the upper thoracic spine. So give me a deep breath in. Put a little more motion here, the ribs. I find this on almost all my patients. We have to keep these ribs tuned up. So as you breathe, your ribs should kind of open and close. Most people don't realize they're not getting full movement of their ribs. They realize it after we fix it, and they go, wow, I didn't realize I couldn't breathe well. That restriction in rib motion, for a lot of people, it may manifest as maybe headaches, or they're just fatigued. They don't have as much energy as they should because they can't breathe efficiently. Okay, head to the right. All right, that's perfect. Head in the middle. I think we got the spine. Let's double check the low back. Lift here. Lift here. Okay, let's get you on your back. So she can relax here. Now we're going to assess her knees and ankles, since she likes running. So you can put that leg down. Bend here, turn that in. This is a muscle test. Hold that nice and tight. This knee feels perfectly fine. In the tibia, we check the fibula. That's gliding really well. If that fibula can't glide properly on the outside of your knee, it can cause pretty severe knee pain. Hold that tight. And it's actually very easy to fix. And then also throughout care, we've advised Ann on quite a bit of homework. Trigger point work she can do on her legs. I've taught her how to decompress her low back. Feet feel really good today, which is great.
I'm doing my homework.
All right, good. So these are adjustments. When I'm adjusting the feet, what I'm doing is I'm going through each arch. There's 3 arches in each foot. We're just making sure they can move freely. Your arches should be able to move and respond to the impact of walking and running. And that's it. She's done.